Welcome to Summarize Science, where we dive into the latest breakthroughs in medical AI. Imagine swallowing a tiny pill that records a video of your entire digestive system. This is called capsule endoscopy, and while it is non-invasive, it produces an overwhelming 8 to 12 hours of footage per patient. Researchers have introduced a new task called diagnosis-driven video summarization to help doctors find the needle in this massive medical haystack. One of the biggest challenges is that interesting medical events are extremely rare compared to the thousands of normal frames. Simple methods like taking a snapshot every few minutes often miss the lesions entirely or capture useless frames of bubbles and debris. To solve this, a new framework called DICE was created, which stands for divide-then-diagnose. This system works by first filtering out the junk and then organizing the remaining frames into logical groups. To train this AI, the team compiled a massive dataset called VideoCAP, featuring 240 full-length patient videos with actual clinical reports. This is the first dataset of its kind to include timestamps that match real doctor diagnoses for every single finding. The AI doesn't just look at one frame, it looks at the context around a potential problem to make sure it's not just a blurry artifact. This mimics the way a human clinician would look back and forth at nearby frames to confirm what they are seeing. The architecture of DICE includes a selector that does a quick sweep to find anything that looks suspicious. Then, the context weaver organizes these frames into anatomical contexts to keep the summary organized by where the camera was in the body. Because the camera moves randomly, the AI uses a dominant label prior to decide what a specific area actually contains. It essentially takes a vote among nearby frames to decide if a lesion is real or just a glitch in the video. When tested, many general-purpose medical AI models struggled to accurately identify specific issues in these long, messy videos. However, the DICE framework significantly outperformed existing methods, showing much higher accuracy in detecting lesions like ulcers and erosions. It managed to cut down the total number of frames to a manageable summary while keeping the most important clinical information. The researchers also looked at label switching, which is when an AI gets confused and flips back and forth between different diagnoses rapidly. DICE was found to be much more stable, reducing these confusing errors by 8 to 9 times compared to other leading AI models. This stability is crucial for ensuring doctors can trust the AI's suggestions. By removing the need for a human to watch the whole 12-hour video, this technology could drastically reduce the workload for busy gastroenterologists. It also makes the final reports more reliable by ensuring that no subtle findings are buried in hours of redundant footage. The researchers hope this marks a new era in AI-assisted medical reviews. Let's recap the important points. Doctors are currently drowning in data from these tiny pill cameras. This research provides both a massive new dataset and a smart AI framework to summarize that data effectively. It works by filtering, grouping, and then confirming medical evidence just like a human expert would. This leads to cleaner, more consistent results and fewer misdiagnoses for patients. In the future, this could mean faster results and less burnout for medical professionals everywhere. This is a perfect example of AI solving a very specific and very tedious real-world problem. Thanks for watching Summarize Science, and stay tuned for more fascinating research.